We are honored to be joined by Bob Garrett, who is the CEO of Hackensack Meridian Health. Good to see you, Bob.
Good to see you, Steve.
We are taping this at the end of January 2022. We will not talk about the football giants. Bob and I are hardcore fans. We're acting like the season never happened. Let's move on to other issues.
That's a good thought, Steve, right there.
Yes. However, I do want to ask you this, big picture, because if people want to find out what's going on every day, check out NJ Spotlight News, Metro Focus, but big picture, long-term impact of COVID on the healthcare system / the hospital system. Please, Bob.
Yeah, so the long-term impact on hospitals and health systems from COVID is really significant, starting from the financial impact. And we're going on 2 years. March 4th, 2020 was our first COVID patient. In year one, 40% of hospitals across the U.S. were operating in the red because of loss of revenue or additional expenses related to COVID. The 21 experience wasn't much different. And as we got into 22 with the Omicron surge, we're seeing, some significant financial impact. So certainly, I think hospitals and health systems are going to have to reinvent themselves, reimagine themselves as they come out of this pandemic and think about what's going to work and what's not. A couple other trends that, I think will emerge from this pandemic. One is technology and specifically telehealth. We saw it surge during the first part of the pandemic. I think when the lockdown occurred, about 80% of all health visits were being done through telehealth and telemedicine. That did drop significantly when folks started to come out and started going back to their doctors in person, started using hospital emergency departments again. But I think overall, we're probably going to see a steady rate of probably about 30%, 20 to 30% of all visits will be done through telehealth. The third trend, I think, that is really apparent from COVID is the impact that the pandemic has had on mental health, mental illness, behavioral health. So I think there's going to have to be, from the hospital perspective, from the health system perspective, a real focus on behavioral health issues going forward. There's been a stigma for years and years. Some hospitals and health systems have tried to face this challenge head on. Others haven't. I think there'll be no choice going forward. And then, lastly, I would say health equity is going to be a big issue. The pandemic certainly brought out the fact that there are major disparities in healthcare outcomes depending on where you live, what your zip code is, what your race is. As an example, people of color were 3 times more likely to contract the virus, 2 times more likely, in a very sad way, of dying from the virus. So, I think that the focus on healthcare outcomes is going to really be significant and something that we're going to have to continue to focus on once the pandemic is behind us.
Bob, I want to follow up on particularly one of the areas you mentioned. And I've disclosed this before. Hackensack Meridian Health is an underwriter of our healthcare programming, but also I teach in what's called the Physician Leadership Academy at HMH. And one of the issues that does come up with those physicians, and we're doing them remotely right now, hopefully we'll be in person sometime soon, but we don't know that. But the issue of wellness comes up a lot. The issue of, and I know Dr. Amy Freeman is leading that effort as well, and she's been part of those discussions that we've had with your physicians. Here's the question. What exactly can a hospital or hospital system, which, by the way, if we're talking about HMH, it's 17 hospitals, 36,000 employees, what exactly can you do for those physicians, not to mention the nurses and respiratory therapists? How do you help them, Bob?
Yeah, we really, first, let me give a shout out to our healthcare providers, the folks on the front lines that have been battling this virus for now 2 years. The resilience that they've shown, the courage that they've shown, the perseverance is incredible. Our doctors, nurses, other professionals like respiratory therapists, incredible. As I round through our hospitals and I see it firsthand, I'm just in awe of the job that these women and men are doing. What we can do to help support them is really a multitude of things. You mentioned Dr. Amy Freeman. She's our Chief Wellness Officer at Hackensack Meridian, and she has worked in conjunction with mental health professionals, behavioral health specialists at the Carrier Clinic, who we're affiliated with, who is part of Hackensack Meridian now, and we put in place many wellness programs for the front line. We try to support them. We try to encourage a work-life balance. We have support groups that have been formed. We have relaxation stations, stress relief centers as well. We have specialists and therapists that are on board at each of our hospitals. So as nurses, as an example, come off their shift, they're able to support their efforts. The other piece that I just want to point out, and this is something that maybe has not been talked about a lot, but
Sure.
think about 2020. And all the support that our frontline caregivers had from the community. I mean, there were parades, there were lawn signs.
Our heroes. There are heroes. What's happened to that, Bob? Sorry for interrupting. There are heroes. Are they no longer our heroes because we're tired of this? There's COVID fatigue, but it's not, for them. They have no choice.
Yeah, that's exactly right, Steve. They still are healthcare heroes. They're true American heroes. But the support from the community just hasn't been there. And I think part of it is fatigue. Part of it is the country is divided, and we see that at our hospitals as an example. There's a significant increase in physical and verbal abuse of staff members. You've heard about it on the airlines, right? Flight attendants are constantly facing that.
Again, sorry for interrupting, Bob. From patients to the people helping them, doctors, nurses, respiratory therapists. What could that possibly be about? It
could be as simple as, somebody doesn't believe in the mask mandate in hospitals. It could be that we're checking vaccine status. So, people have very strong beliefs about these issues, but, we have to do what's right to protect our patients, their families, and our staff members. We're seeing it, particularly in the emergency department. We're seeing a significant increase, and not just Hackensack Meridian. This is across the nation, Steve. It's been reported on, maybe not as much as it could or should be, but we're seeing a significant increase in violence, in physical and verbal abuse of frontline doctors, nurses, others. So it is an issue. There have been some health systems who are asking, patients or visitors as they come in to sign forms saying that they will conduct themselves in a certain way. We at Hackensack Meridian do have signage up asking people to be respectful of their caregivers. So in addition to everything we're doing through people like Amy Freeman, our Chief Wellness Officer, I think it's important that the general public understand the folks at the front lines are really fighting this virus every day. They're doing the best they can. Some of the regulations that folks are objecting to are not really even things that they have control over. They may have been mandated by the state or the federal government or the Center for the CDC. It could be something like that. But I just want to point that out because I don't think that has gotten really a lot of attention over the last several months.
Bob, let's do this. We're going to finish this segment right now, but if you could stay with us, I know your schedule is ridiculous in terms of how tight it is, but can you give me just a couple minutes right after this? We'll talk about the nursing situation, because that's a part of this we really need to discuss. I want to thank Bob Garrett, who is the CEO of Hackensack Meridian Health. Bob, thank you so much. Best to the family, the team at HMH. Thanks, Bob.
Thanks for having me, Steve.
Stay with us. We'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Horizon Blue Cross Blue Shield of New Jersey, Johnson & Johnson, the Fidelco Group, TD Bank, New Jersey Sharing Network, the Healthcare Foundation of New Jersey, the Port Authority of New York and New Jersey, the Northward Center, and by the Robert Wood Johnson Foundation. Promotional support provided by bestofnj.com and by CIANJ and Commerce Magazine.
The Northward Center was founded on the vision that community is connected to neighborhood stabilization, and neighborhoods need a place for kids to play. That's why we're building a recreational complex in the heart of Newark. Unfortunately, inner-city youth development programs are dwindling. We want to expand on our promise and build a place where kids are welcomed and doors remain open. The North Ward Center, building a better community, 48 years and counting.